Did you know that the Hispanic Latino population is 1.5 times more likely to develop Alzheimer's disease than older non-Hispanic white populations? Well, the Alzheimer's Association is funding research to look at that disparity, and that may just be the first punch of what is a double whammy here that we need to talk about. So joining us now on this second day of Hispanic Heritage Month to talk about the issue is Dr. Carmen Carrion, a neuropsychologist and assistant clinical professor at the Yale School of Medicine and the Alzheimer's Disease Research Center. Doctor, thank you so much for joining us today. How are you?
I'm doing well. Thank you very much for having me.
Yeah, glad to have you here. First of all, just to clarify, is this population more likely just to get Alzheimer's disease or all forms of dementia?
All forms of dementia. It's a great question.
Okay, and what do we know about why?
Well, we know that the greatest risk factor for dementia is age, and there's not much we can do about that. But our individual risk can also be affected by genetics, lifestyle behaviors, and many more social, economic, and environmental factors. We, of course, also see links between dementia and medical conditions that can affect heart health. But what I tend to see in my clinical practice is that Hispanics show up with more of these risk factors, especially higher rates of high blood pressure and cholesterol. And then there's also complex social factors, especially for older Hispanics who may have migrated to the U.S. and have had limited financial resources, fewer opportunities to go to school or to learn English. But it's not all negative, as bad as it sounds. There are also protective factors. So for instance, Hispanics tend to live longer than Black and white non-Hispanics. And we often call this the Hispanic paradox because it seems contradictory and it's difficult to explain. So what this means is that we have many more questions than answers, but there's a lot of opportunities to get involved and help us answer these questions.
And please tell us about some of those opportunities to get involved.
Sure. Well, there are research studies, and research is the way that we can get answers to our research questions. So especially with medical conditions, we can figure out medical advances, new medications, hopefully someday find a medication that might prevent dementia from starting in the first place. And the issue is right now that Hispanics are currently underrepresented in research. And, research participation, it doesn't have to be too involved. For instance, I'm currently doing a study where healthy Spanish-speaking volunteers are asked to answer questions about their thinking abilities. And once we have these results, we'll be able to use these answers to more accurately identify changes in people's thinking abilities, especially for Hispanics living in the U.S.
And also for people who would like to get into trials, the Alzheimer's Association has a trial match program to make that easier, to help facilitate that. So, Dr. Carrion, I'm sorry that we are out of time. Thank you so much for taking the time to join us, just to at least make us aware of this disparity. I'd like to talk a lot more in the future days and weeks with you and your colleagues about what we can do to try to rectify this problem. Thank you so much.
Thank you for having me.